ICSI, or intracytoplasmic sperm injection, is a technique that was developed for men with poor sperm quality or poor sperm quantity in the 90s. We are now able to achieve fertilization for men where it previously seemed impossible. It is now used exclusively in some clinics, and it's especially important for people who are undergoing PGT testing of their embryos. When we do ICSI, we pick one sperm and we drop it off into the center of the egg. So there are no contaminating sperm around the outside of the egg, and we also get a very good view of the quality of that egg and the maturation of the egg. So there are three different kinds of eggs, at least three different kinds of eggs that can come from an IVF retrieval. The most mature type of egg is called a meiosis II, or we refer to it as an M2 egg. Those are the eggs that we can inject with ICSI. A less mature type or a more immature type of egg is called an M1 egg. Now that egg still has a little bit of work to do to separate its chromosomes out to be ready for ICSI. And occasionally those eggs do mature in culture, and sometimes they don't. And there's another type of egg called a GV egg. GV stands for geminal vesicle. Those are the most immature type of eggs, and often those eggs don't ever mature to be able to be used for ICSI. So in conventional IVF, the egg and its surrounding cells are placed into a well with the sperm that we prepared with one of the methods that I spoke about earlier. And the next time we can take a look at that egg is in the morning of the next day when we look for fertilization. So that egg is essentially going to be a mystery until we take a look at it. Was it mature at the time we combined it with the sperm? What was its quality? We wouldn't have answers to any of those questions. So one of the reasons why we like to do ICSI almost exclusively for couples is because it gives us more information and more control over the process. And in the end, it allows us to get more embryos for you, and the more embryos you have, the better chance of a pregnancy. So we always recommend doing ICSI 100%. There's another variation of ICSI, which is called PICSI. PICSI stands for physiological ICSI. It uses a specially coated dish and a substance called hyaluronin. And healthy sperm are attracted to that hyaluronin, and they stick to it, and those can be used to inject the sperm later with. Now, the theory is that that's a little bit closer to what happens in nature, and that nature has a way of picking the best sperm. But among the people who I've spoken to, and in my own experience, we don't find PICSI to be particularly helpful to the outcome of ICSI. So typically I only use that at the special request of a patient. So why do we use ICSI so much in the lab and instead of conventional insemination these days? I would say the incidence across the US of 100% ICSI cycles is maybe almost 70% of all cycles now. That's a humongous jump. And I think one of the things is the fear of an unexplained failure to fertilize event. We never want to see that happen for a patient because it's devastating. And it does happen occasionally, even with the use of ICSI. But the use of ICSI can help us get around all kinds of male factor infertility problems. So normally fertilization by insemination relies on normal, healthy sperm cells, and that can be bypassed in the case of severe oligospermia, which is low sperm concentration, asthenozoospermia, which is low motility, or teratozoospermia, which is abnormal morphology of sperm. All of those are really good reasons to use ICSI. But like I said, many clinics now routinely use ICSI 100% no matter what the diagnosis is. So I want to talk a little bit about sperm DNA fragmentation, because the DNA fragmentation index of sperm is one of the reasons why you may have embryos that look like they've fertilized healthily on day one, But at day 3, they fail to continue growing as embryos. So sperm DNA fragmentation can be caused by a variety of factors: infection, chemotherapy, radiotherapy, smoking or vaping, drug use, advanced age. And sperm DNA fragmentation is linked to impaired fertilization rates, poor embryo quality, and increased spontaneous abortion rates, essentially reduced pregnancy rates all the way from the beginning to the end. And currently, there doesn't seem to be a lot of evidence to support the routine use of sperm DNA fragmentation testing when doing our routine workups for men. But repeated failure of embryos to develop or repeated fertilization failure is a really good reason to look at that sperm DNA fragmentation index and try to improve it through supplementation, lifestyle changes, oral antioxidants, varicocele ligation, frequent ejaculation, or maybe even some sperm sorting methods. Now, let's talk about eggs a little bit. So I told you a little bit about the 3 different types of egg maturities. There's GV eggs, M1 eggs, and M2 eggs. GV is the least mature, so the most immature, and M2 eggs are the eggs that we can inject with ICSI. A protocol called in vitro maturation was developed as an alternative to traditional IVF due to the adverse outcomes of ovarian hyperstimulation syndrome and the cost administered with associating FSH. Now, this treatment is not widely used in clinics, but it has the potential to overcome some types of infertility that have to do with the quality of the egg. So, for example, in women that have estrogen-sensitive tumors or blood clotting medical conditions, this could be an important way to obtain mature eggs without hyperstimulating the woman in a stim cycle. And another technique that can be used with oocytes is called oocyte activation. So there's a very small percentage of individuals who continue to face repeated fertilization failure, even with a normal sperm parameters, good ovarian response to stimulation, and multiple cycles of ICSI or an IVF. So normally when the sperm binds the egg, a cascade of events occurs that results in waves of calcium ions surrounding the egg. This is called egg activation. If this is missing or deficient in a patient, it results in embryos that arrest and cleavage stage defects of embryos. So calcium ionophores are molecules that can be used to increase the concentration of calcium ions inside the egg. And when we artificially apply those calcium ions in the lab, we can activate the egg so that fertilization can occur. Now, there was a recent meta-analysis, which is a look at all of the studies together that have come out recently about calcium ionophore activation. And they looked at 14 different studies, and they found that the calcium ionophore increased fertilization, increased embryo cleavage, and blastocyst rate, and implantation rates. So overall, the pregnancy rate and the live birth rate were increased. And so what we can say about that is that, while again, it's not routinely used in the ICSI lab, calcium ionophore treatment might be especially good for patients with specific conditions. There's a sperm condition called globozoospermia, which is where the sperm fails to create an acrosome, which is a sort of a bag of enzymes around the sperm head that's needed for proper fertilization. And a couple of the other things that I mentioned earlier, if there was previous failed fertilization and previous embryo arrest, those might be good reasons to use calcium ionophore activation. So now I want to go on to one of the hottest and most contested topics in embryology right now. This is the use of DHEA, or dihydroepiandrosterone. dehydroepiandrosterone. Dehydroepiandrosterone. It's one of the hottest topics in IVF right now because DHEA, for short, is being used by some clinicians to rejuvenate ovarian function. Currently, 1 out of every 4 cycles is characterized by poor ovarian response. And poor responders suffer from a diminished ovarian reserve, and there are fewer oocytes available, and decreased rates of pregnancy in these individuals. Oh, some studies claim that the use of DHEA supplementation can improve pregnancy chances in women, especially women that have abnormal embryos, because it increases the quality and the quantity of the eggs when you have a diminished ovarian response. So, according to these reports, the number and quality of the eggs is increased, and the risk of miscarriage is reduced, shortening the time to pregnancy. Now, these results sound amazing, and I think one of the things that we'd like to see in the medical community is more studies of even higher quality and coming from a diverse set of institutions. So there's not really a lot of studies that have been done, and they're all coming from essentially 1 or 2 different places.